Thank you so much for joining us. This is All Angles. I'm Dion Jackson Miller. We've been talking about public health a lot recently. In last week's program, we heard from stakeholders. So for this week, we invited the Health Minister, Dr. Chris Tufton, to come and sit with us for a special one-on-one. Thank you so much. We really appreciate your coming in.
Thank you very much.
You know, Mr. Minister, I think I may have said this to you in a previous interview. I've heard healthcare workers say this, but a lot of the time they say they don't feel that you as minister are getting the correct information from your advisors, so that the image you're portraying is completely at odds with what they're experiencing. Is that something you've actually thought about and looked at whether or not it's so?
Well, I am prepared to say there are always going to be margins of error in terms of information flow. One of the things I pride myself in is that I don't stay in office. I'm on the road 2-3 days a week. I'm in hospitals, in health centers. I talk to people on the ground. I am prepared to accept that the situation is not perfect. It's a very dynamic situation depending on what is happening at a particular point in time in a particular place. But the truth is, we can always tighten up on management. There's no doubt about that. There are areas of weaknesses, but we have done a lot to improve in many ways the circumstances of the healthcare environment and for the healthcare worker, certainly when compared to what used to be the case. So while I will say that I am always prepared to listen, that is the right thing to do, we continue to try, I continue to try, and I have to work with a team, as you know.
I have to tell you though, when I interview you, almost inevitably my phone starts blowing up, and healthcare workers all over the country message me and say, and tell me what the minister is saying is not so.
Like
and not
what?
so it go. It's inaccurate.
Give me an example.
Things like operating,
I think
operating theaters,
yes,
which are said to be working, which they are saying are dysfunctional. That's just one example.
Well, I think we have to drill down to specifics now, because when we talk in generalities, I think it becomes an issue. It's easy to generalize. I was in Mandeville on Friday, and all 6 operating theaters are functional, if we are to get specific. There was a time at KPH, you and I spoke at it, when there was a serious issue with operating theaters. I don't know how many of them are working now, but a number of them are. And I know that there is a processing train to do work on a few others. So the point I'm making is that I'm always prepared to accept criticisms. I'm always prepared to listen, but I have to drill down to the specifics. So when there's an issue, we zero in on that issue. We identify the specifics around that issue, because health is a very emotional space. It only takes one problem or challenge to create an impression across the board. So let's look at healthcare workers, for example. The government has almost doubled the number of posts for healthcare workers to ease the burden and the stress associated with doing too much work. The challenge right now is not so much about posts. The challenge is about the numbers and hiring the numbers, particularly in the specialized areas. So specialist nurses. Take compensation. The government has made significant increases in terms of compensation. Doctors and nurses, healthcare workers generally, are earning far more than they used to earn. And I could go on and on in a number of areas. Now, that's not to say that everything is okay, but we have made a lot of progress. And I'm prepared to defend that. And where there are concerns, what I would call on persons to do is to identify the specific concern in the specific institution. And I'm prepared to take those on and to listen. And I get a lot of WhatsApp every day too.
Okay. Well, let's listen to the president of the Nurses Association of Jamaica, who spoke on this program last week.
Sure.
Let's bring that up.
The nurses got rested from last week, or Wednesday. But what we would have seen in the media would have been the activity on Friday. It is a culmination of a lot of things. Poor infrastructure, lack of resources, and severe overcrowding. The overcrowding is really concerning for us because it speaks to the dignity of individuals. And, you know, when I went to that facility yesterday and I walked into the refashioned A&E, I was shocked.
This is at the Mount Salem Community Center, I think it is.
Yes, it is.
Tell us what shocked you.
So this facility was refashioned to facilitate 3940 clients. They had 115 in it yesterday. And it's hard for you to really care, give any kind of care. You know, one of the questions I asked one nurse, I say, how do you prioritize who gets care and who doesn't? The major issue is that there's no bed space for admission.
Right.
So the persons that are in the space, maybe 80-90% of them are actually for admission. But there's nowhere to put them. Cornwall Regional originally is a 300-bed facility. They would have lost the use of about 147 beds after Melissa based on damage to infrastructure. So, you know, that further compounds a situation that already existed. The whole story of seeing people on stretchers that are at floor level is harsh. You see people on beach beds, beach chairs. Those are the things that persons are being nursed on.
And just before the minister responds, let's hear what the president of the Jamaica Medical Doctors Association had to say as well.
A lot of the staff members, doctors and nurses, they buy their own equipment because you can't sit and wait till the 50th patient to that blood pressure. I mean, that person is crashing now, right? And that is your patient on the line, and that is you. And every time you lose a patient or you cannot treat a patient, that does something to you, especially when you love your patient and you love your work. So you know that, okay, I'm going to make this sacrifice, and I'm going to buy this, and I'm going to buy that. I sometimes have to buy my own surgical equipment. And I'm not the only president of the JMA that has come on national television and said that.
Like what kind of equipment?
All right, for example, forceps. Forceps that I need to use when I'm doing operating. Sometimes I have to choose the knife that I have to purchase so I don't cut the wrong thing. We have to buy some of those things for ourselves, and that is the unfortunate situation.
Okay, so very specific there. So let's talk about a couple of those things. How is it okay that we're hearing nurses have to buy blood pressure machines, doctors have to be buying forceps and knives to do surgery?
Right.
How is that okay, and why is that happening?
Right, but before that, I want to address the initial comment about the Cornwall.
No, I'm going to come to that, though.
You're coming to that? Mm-hmm. All right, so once you will come to that, we can deal with the other issue. There are circumstances where doctors buy their own personal items, and there are circumstances where they are provided. The reports I get, and it depends on the institution. Some institutions are better able to manage to ensure that there's a sufficient accountability when these smaller items in particular are purchased. Other institutions claim that they purchase and they disappear, and what it leads to is a shortage. But as a routine, the regional health authorities have a responsibility to support, through its budgetary allocation, the purchase of most equipment. Doctors may have preferences and they may decide to buy something that they prefer to use, and they personalize it and take it as they carry out their duty. So it's not that these things are not budgeted for or not purchased, but the accountability around whether they are available when they need to be available is a function sometimes of the management of the institution. And that's the report I get when these things are brought to me. And then, of course, I intervene through the regions.
Which is why I started out by asking about the advice you're giving, because what we just heard from a very frustrated Dr. Badjo, this is not somebody who is doing this out of choice. She's saying she needs to do surgery, she buys her own equipment. And one of the things we know about healthcare workers is that they generally do not go public with their grouses.
Really?
When you see them, when you see them go public, they're at the end of their tether because they are threatened with things like the Official Secrets Act.
Yes. No. Well, I'm telling you, this is not one minister that threatens people with secrecy act.
Yeah, but you're not the only person in the ministry.
No, but I'm saying this is something that I don't want the impression to be given that somehow we're about. It
does happen, Dr.
I meet. Hold on, let me just clarify. I meet with the heads of in fact, tomorrow I'm meeting with the president of the NAJ. Yesterday I was with her at the launch of her 80th anniversary celebrations, and indeed, It would have been nice if she had called me about the issue at Cornwall, because Cornwall, clearly the discussion there, and maybe I missed some of the clips.
Do me a favor, don't reach Cornwall yet, because I don't want to come off this issue. I just want to drill down back to this, because you see, what is happening is that, again, what people are hearing is what sounds like a glib answer. Yeah, man, we buy stuff, and some people prefer to buy their own. And the reality is that we have frustrated doctors and nurses saying we have to buy our own equipment. And I'm not hearing an acknowledgement of that as a chronic problem in the system, which the healthcare workers say it is.
And what I'm saying, because this is not a glib response, I'm saying where those deficiencies exist and those issues are brought to the attention at the level of policy. Because remember now, these institutions are managed. They have CEOs, they have SMOs, they have a regional health authority. We do what is necessary to intervene.
But they exist every day. The healthcare workers experiencing this every day.
But that doesn't change the point. Where they exist and they are brought to the attention of the policymaker at the level of the ministry, we try to intervene to address them. It's not that budgetary allocations are not provided for these things. It is not the case. And in fact, more budget has been provided under this administration, from $60 billion in 2016 to $140 billion the last budget. So a lot of times it's not so much a function of money. It is a function of how the institutions are managed, and where the management is deficient and it is brought to our attention, there's an intervention. And I'm prepared to say that without fear or favor. Similarly, when the associations like the NAJ or the JMDA wants to meet, I always accommodate them, and we have conversation around what they think are deficiencies, and we try to address it. So, you know, it's always going to be a work in progress, and there are levels of inequality, if you will, depending on the institution and the regions, and we do try to address them as best as we can. But it depends on a system, and it depends on a culture, and it depends on the management. And I'm not going to say that it's perfect. There's still a lot of work to be done.
Does this not say to you that the systems, and let's assume that what you're saying is correct.
Right.
Does it not say to you then that the systems are inherently inefficient, and that the management, not trying to throw anybody under the bus, but I'm following on from what you're saying.
Yes.
The managers then are inherently incompetent if they can't keep basic supplies in the institutions.
Listen, we did not, the truth of the matter is that there is a cultural issue, and there is an issue around efficiency that we have to drive and improve on, which is why we're building out more facilities, which is why we're adding technology through IT to do things like patient records, which is why we're improving on our inventory management systems. We have come a far way, but we never invented a bed of roses. Healthcare was in much more crisis when we took over in 2016 than it is now. In many, many ways, there was a lot of deficiencies in the system. Now, you may argue that 9 years is a long time to turn things around.
All under your watch.
But yeah, of course, I can't deny that. The truth is that the culture doesn't change overnight. And for every deficiency that you can identify, I can identify a positive where patients are better off. I mean,
hold on for me, Dr.
Yes.
Tufton. Let's just go to the break. We're talking to the Health Minister, Dr. Chris Tufton. We're back in a moment. Remember our WhatsApp line, 2540693. Give us your first name, your general location. Soon come.